The only thing I knew about the case at the time was that he had a diagnosis of lung cancer and that he was 89 years old. And when I first came to the house to do the start of care visit, I met with his wife and himself, and there was 3 of 5 children there, adult children. When I walked in and introduced myself and shook his hand, I could tell right away that he was a very proud man and very used to being in control of his surroundings, and that this was going to be difficult for him. After talking to him for a little while, I found out that he had had the diagnosis of lung cancer in his other lung and was just several months away from being cancer-free for 5 years. So that was also played a big role in caring for him, because he had had this before, but he had had treatment at that time, and this time there was no treatment available for him. Well, for the majority of the time that I was visiting with him, he would call it his condition. I'd ask him how he was feeling. As well, I have this condition. And maybe about a week and a half before he passed away, and he was declining and having much difficulty walking and wasn't able to eat anymore, he said to me, "Amy, I think the disease is getting worse." And I said, "I think you're right." And then the day before he did pass away, I was helping him get back to bed, and he just looked at me and said, "Amy, cancer really sucks." And I said to him, "You're right about that." And just as the disease progressed, so did he in his acceptance from his condition to admitting to himself that it was a disease, and then being able to call it cancer. And I think once that happened, he was really able to realize that it was okay to let go. And he did in probably less than 24 hours. The night that I had pronounced him, though, we were talking and they were thanking me for having their dad comfortable at end of life, which he was. And that was not the impression that was given to him when he was first diagnosed with this cancer. And the daughter-in-law, whose mother had been on a hospice, said to me, "Amy, I want you to know that I was against this up until last night." And she said, "My mother was on hospice and it was a horrifying experience for me, but I have to say that you have restored my faith in the hospice program." It was an honor caring for him. And my only regret is that I didn't get to meet him earlier. He was a wonderful man and had me laughing a lot.